Well, bird flu. It's arrived in the Finger Lakes. Cornell scientists discovered it in snow geese in Seneca County, and one Long Island farm has had to euthanize more than 100,000 ducks. The disease also hits dairy cattle, which is important in our area. And while doctors have confirmed 67 human cases, the CDC said it doesn't have any evidence that it happens person-to-person transmission. But Aaron, is this outbreak getting enough attention?
No, we need to be worried about it. And actually, the price of eggs dispute that we've seen recently, if you've heard about bird flu, you might have thought about the price of eggs and the connection there. I think will actually help get it some more attention. And here's why it's critical. If you were a chicken, this would be your super COVID moment, right? 20 million chickens died in the last quarter of 2024, egg-laying chickens in the United States from bird flu. Not cold, not euthanized, but they died from the spread of this really devastating disease in birds, right? But the concern, of course, is it going to spread to humans? It's in dairy cows. Dairy cows are getting reinfected. It's jumped into humans. It's one mutation away, right, from being able to spread between humans. Right. It's one mutation away from being more virulent, right? So it's not a danger right now to us, but it's really close, I think is the message. And so we're going to want to pay attention to what needs to be done. We don't want to be touching dead birds. We don't want to be interacting with infected animals, and we don't want to be consuming raw milk. The food supply is safe, the eggs are safe. We'll see what happens with the price of eggs, but one of the reasons why the prices have gone up is the supply's gone way down because there is an epidemic in the bird world right now, and we got to watch that closely. We'll see what Trump's CDC and other health agencies, confirmation hearings for Department of Health and Human Services are right now, are prepared to do about that. So far, what Trump has said is, well, culling the chickens is what's causing the egg prices to go up, and that's not exactly the right point to be making.
Yeah, I mean, I'm very worried about both sort of the federal government's, monitoring, response, preparation, right? Particularly post-COVID, right? Because there's this sentiment that the government went too far, and in some respects it did. I mean, I still maintain that children were kept out of school for far too long to their everlasting detriment, and other things like that. But besides the government's response and preparation efforts and focus on actual science, which I think is concerning, I'm worried about the public's response. Should this jump be made, right? The public is in no mood. Many people in the public are in no mood to, again, sort of be subject to or to be compliant with public health measures. And so I'm quite concerned and reading a lot of stories about it, and I appreciate Aaron's discussion of exactly where we are.
Tara, New York has been doing some education and much more testing of milk, but is the state doing enough, do you think?
I think right now it is doing enough for exactly the reasons that Lisa suggested on the national level, because the public mood really doesn't see this as urgent. They don't see this as a major crisis for everyone other than in terms of egg prices. And so for the New York State Department of Health to be doing the testing that they're doing seems reasonable, but it doesn't seem egregious. And that's kind of where the mindset is.
Good. Michael, what's your take on this?
I want to say very quickly, it just makes us really appreciate the moment of the confirmation of RFK at this moment. And I watched a tiny bit of the histrionics that go on. They're trying to question his moral turpitude and his ethics, and that doesn't matter to those people. If I were there, I'd ask 5 basic questions. RFK, do you have an associate's degree in public health? No. Do you have a bachelor's degree in public health? No. Do you have a PhD in public health? No. Have you done a postdoc in public health? No. So why should any rational American want you to be the head of any government agency that has to do with public health? We learned our lessons from the pandemic. If this person is in charge, and we just pulled out of the WHO, I'm not exactly sure where this thing's going to end up. This is a problematic moment, and to draw serious focus onto his confirmation.
But will bird flu be an issue in what the Senate votes?
We'll wait and see, I suppose.
I mean, there seems like some other issues with his nomination. Tara, you said last week that the current government's pulled out of the WHO, and that's the organization that internationally would be monitoring this bird flu. So that's an issue, right?
Oh, absolutely it is. It's an issue because it puts the onus on those who are in those organizations and American scientific organizations who may or may not have funding. We don't know if they're going, officially they still have funding, but maybe they won't have funding. They're still sort of waiting to see how this all plays out. But so it puts the onus on them to voluntarily share information if they're allowed to, because there has been some question about whether they'll even be allowed to share information with organizations like the WHO, since we're not a part of it. So, you know, it really brings home the importance of the international scientific efforts to control pandemics, foresee potential pandemics.
Erin, how about, go ahead, Lisa.
I was just going to say, I think one of the complicating factors here is that there have been outbreaks of bird flu in the past that have gone nowhere, so people think, oh, it's bird flu. We've lived through this before, but it's a different strain.
And it's a different strain, and part of why it's gone nowhere is the government's gotten ahead of it, right? Yeah. And if you're listening to all this at home and you're saying, you know, I'm really concerned about the government doing too much, spending too much, the bloat of the federal government, the last 3 years, 2022 to 2024, the U.S. Department of Agriculture has given farmers $1.25 billion to cover their losses from bird flu and from the culling of birds to spread the disease. In other words, farmers get compensated when they lose all of that, and they get compensated by the federal government. That's the current law. So it's costly to the federal government to have this epidemic be spreading, you know, through the.
And that means it's costly to us.
That means
and
it's
our
costly
farmers
to us.
sufficiently being incentivized to take steps to do enough.